We will talk about jaw exerciser rubber, its safety, its effectivity. Usually it's silicone or rubber devices and different shapes and different colors, and you should chew, and it improves function of jaw muscles, and also marketed as strengthening of jaw muscles, improve facial symmetry, improve jawline, and improve temporomandibular function and reduce pain if there is. So it's marketed heavily, and let's examine what studies we have and what study says. First study we have, it improves maximum biting force. They observe people who exercise 8 weeks and around 20 to 30 minutes per day, and it improved maximum bite force. Of course it's good and effective, but this effect disappears soon after they cease this exercise. So this effect was very short term. Another study was this exercise rubbers really reduce temporomandibular joint pain. So it can have some effectivity in case of temporomandibular joint pain. Also it improved cheek shape and reduce age of face. I can say that it's important finding, and people was exercising around 20 weeks at this case. So improved cheek shape and reduce age of face is really important. But problem is that most of these studies are small studies, and we have no long-term effects. We have only short-term observations. Also, it's questionable how well was this study designed, and if there was any conflicts or not, and who ordered these studies and such things. So we need more studies to say more definitely if these jaw exercisers are effective and safe. But what we know according to these studies, they are effective. Also, after 8 weeks it enhances jawline and improves facial symmetry is also important. So facial symmetry improvement for many people is very important, because most of people face is asymmetry. So facial symmetry regain is very important finding. Also it improves facial appearance, and it was examined by independent observers. It's important finding. I think the study was made by 20 weeks and 20 weeks observation was made. It's important also. And now let's say about safety. Usually most common problem and issues is dental problems and jaw discomfort or jaw pain, and to avoid such problems you should start with minimal resistance. These jaw exercisers come with different resistance and different strengths, and you should start with minimal and then improve this resistance and increase this resistance over time. So progressive increasing is important, and avoid excessive force during biting down, because you can damage your jaw or your teeth. That's why avoid excessive force, and pause between exercise, because not to overuse your jaw muscles, and it can be it can be problem also temporomandibular joints. That's why you should take rest between exercises, and see usage if any pain or if any discomfort. Now let's summarize what we can say. I can say that I think it's effective. What we know according to studies, jaw exercisers are effective and safe, but long-term safety we don't know. We have no enough information. Also there is some concerns about bacterial growth on this exerciser, because if you don't clean it perfectly, it can be good source of bacteria for oral cavity. Also, there is concern about gastrointestinal tract, but what we know is safe. We don't know long-term effects, we don't know long-term effectivity and safety also. That's why we can't be very decisive when we talk about these exercises, but at first glance it's effective and it's considered generally safe for most people. That's all I wanted to say. Thank you for your interest, thank you for your watching. If you like my video, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.